Good morning, everyone. Today I'm going to present a seminar on capacity assessment, and my moderator is Dr. Mohan Dhyani, sir. Mental Health Care Act 2017, an act to provide for mental health care and services for the person with mental illness and to protect, promote, and fulfill the rights of such person during delivery of mental health care and services and for matters connected with or incidental thereto. Now, first, what is the difference between competency and capacity? Competency is a legal term that denotes a legal status as judged by a legal professional. However, capacity denotes clinical status as judged by a healthcare professional. So, an individual capacity may lie anywhere on a continuum. A continuum from complete liberty, shared assisted decision making to best interest principle substitute decision making, whereas competency is binary. Either the patient can be competent or he cannot be. Capacity. Capacity as per Cambridge Dictionary is the ability to do a particular thing. Mental capacity is the ability to make a particular decision at the time it needs to be made. Capacity is related to legal right to life and liberty as per Article 21 of Indian Constitution. So the capacity is dynamic. It is task specific, time specific. It is a spectrum. It is a clinical decision, and it can be permanent or it can be temporary. Capacity is time specific, as in a person in delirium may do not have a capacity at the time when he is in delirium, but 4 to 5 hours later he may regain his capacity. It is task specific, as in a person with schizophrenia may not be able to decide about the treatment or about the admission, but he may have this ability to decide what he wants to eat or what he wants to wear. The capacity can be permanent or temporary. Temporary as in delirium, and permanent as in dementia. The loss of capacity can be permanent as in dementia. Capacity does not equate to insight. If the person doesn't have insight, that doesn't mean that the person has lost the capacity. For example, a patient who has alcohol dependence may not have the insight, but he has the capacity. He might have the capacity to decide admission or treatment. Any psychiatric diagnosis, for example, if the patient has schizophrenia, that doesn't mean he doesn't have this capacity to decide if he wants, what admission he wants and what treatment he wants. Similarly, cognitive impairment, being on any psychiatric medications, any substance abuse, educational qualification, looks, and poverty does not equate to capacity. Decision-making capacity, according to Mental Health Care Act 2017, Chapter 2, Section 4, every person, including a person with mental illness, shall be deemed to have capacity to make a decision regarding his mental health care and treatment if such person has the ability to understand the information that is relevant to take the decision on the treatment or admission or personal assistance, that is comprehension. If he can appreciate any reasonably foreseeable consequences of the decision or lack of decision on treatment or admission or personal assistance, and if he can communicate the decision by any means. Decision-making capacity as per patient is just the ability to understand the benefits and risks and alternatives to the proposed treatment or intervention, or including no treatment. Capacity assessment is done for admission of the patient, treatment, discharge, for registration of advance directive, and for appointment of any nominated representative. Who can assess the capacity? As per Section 81 of the Mental Care Act 2017, any medical practitioner who can be a MBBS or a Ayush or homeopathy can assess the capacity. A psychiatrist, a psychiatric social worker, a clinical psychologist, a mental health nurse, or having a PG degree in Ayush also can assess the capacity. Principles of capacity assessment as per Mental Health Care Act, there are 5 principles. First is presumption of capacity. According to section 14, all the person with mental illness shall have the capacity to take mental health decision, but may require varying degree of support from nominated representatives to make the decision. Unwise decision, as per section 74, when a person makes a decision regarding his mental health care or treatment which is perceived by others as inappropriate or wrong, that may itself shall not mean that the person does not have the capacity to make mental health care or treatment decision, so long as the person has the capacity to make mental health care or treatment decision. For example, if a patient with schizophrenia decides that he wants to take a treatment from some homeopathic doctor, that doesn't mean that he is not having the capacity. Mental illness and capacity. As per section 3, the determination of a person's mental illness shall not imply or be taken as a mean that person is of unsound mind unless has been declared as such by a competent court. Least restrictive environment. According to section 2, if the patient if the patient is found to be incapable, we should impose least restrictions on the person's rights. The best interest of the person with mental illness. As per section 17, the nominated representative shall consider the current and the past wishes, the life history, values, cultural background, and the best interest of the person with mental illness to take decisions on his behalf. When should a capacity assessment be done? It should be carried out for everyone above 18 years of the age. For the registration of advanced directives as per section 11 of Mental Health Care Act, for independent admission as per section 86, for supported admission as per section 89. Section 89 is supported admissions for 30 days and section 90 is supported admissions for more than 30 days. So when the patient is admitted for under section 89, the reassessment is done every week. And when he is admitted under section 90, the the reassessment is done every 2 weeks. Then before giving any information under section 22 to a person who is a nominated representative, we have to do the capacity assessment. For any treatment related decision as per section 4, we have to do the capacity assessment. Legal implication. Capacity is the basis of informed consent. If the patient has capacity, then only the informed consent will be valid. If the patient doesn't have the capacity, the informed consent will not be valid. As per section 86, 89 and 90 of Mental Health Care Act, only a capacitous person can be admitted independently. Incapacitous patient can be admitted under the categories of supported admission. Now, if a incapacitous person is admitted, then we have to do the documentation. All the professional staff involved in the care and the treatment of the person who lack capacity must keep a record of long-term or significant decision made about the mental capacity. We should keep a record if the patient was assessed for any language or communication barrier, who did the assessment, when did the assessment take place, where did the assessment took place, it was in the ward or in the OPD or in the ambulance, who was involved in the decision making, what information was provided to the patient, what decision was taken, why the decision was taken, and reasoning given by the patient. Now, we have various capacity assessment tools. A few of them are MacArthur's Competency Assessment Tool for Treatment, a Brief Informed Consent Test, Quality of Informed Consent Questionnaire, Evaluation of Signed Consent, and Capacity Assessment Interview. The MacArthur's Capacity Assessment Tool for Treatment is the gold standard for capacity assessment. It is a semi-structured tool and it has two components, a structural test and a functional test. Always a structural test has to be performed before the functional test. The structural test is regarding the presence of a disorder of a brain and mind, and a functional test is regarding the impairment of the decision-making capacity. The functional test, test will include understanding relevant information, retention of information, usage and weighing of the different options, choice and communication of the choice. There are four components of this functional test. There is understanding, appreciation, reasoning, and then expressing of choice. There was a capacity assessment document given by the Mental Health Care Act in 2017. The document was drafted as per section 81 of Mental Health Care Act 2017. According to this, a central authority shall appoint an expert committee to prepare a guidance document for medical practitioners and mental health professionals containing procedures for assessing capacity of a person to take mental health care or treatment decisions. It is a semi-structured document. Now, the components of this document. First of all, it has demographic details. Then the first thing is we assess is obvious lack of capacity, then understanding of information, appreciation of risk, communication, finally the decision making by the doctor, and then the signature of the stakeholder. First, in demographic detail, we'll note the name of the patient, the age, gender, patient ID, date of assessment, place of assessment. Now, purpose of assessment, whether the assessment is for admission purpose, treatment purpose, for appointment of nominated representative, or for registration of advance directive, or for any other purpose. If admitted under which, if the patient is admitted under which section of the Mental Health Care Act, we have to note that. Now, if any advance, the patient who is admitted has any advance directive, if have present or absent, if the patient has any nominated representative, if the patient has any nominated representative, we have to note the name and ID of the nominated representative, and diagnosis, any provisional, if we have come to any diagnosis. Second is, first we'll say obvious lack of capacity. If the patient is in the condition where any meaningful conversation is not possible, such as if the patient is violent, excited, catatonic, stuporous, delirious, or in any alcohol or substance use intoxication or severe withdrawal, then we'll say in such cases, directly the signature of nominated representative can be taken and the treatment started and admission done. In this in this guidelines, a column is left for explanation. We have to write explanation for why we are taking this, the decision after every decision we take. Now, if the patient does not have obvious lack of capacity, then we will assess the patient if he can understand the information. First of all, we'll check if the patient is oriented to time, place, or person or not. If he or she has, then we'll provide the relevant information pertaining to the illness Then we'll ask the patient to follow some simple commands like show your tongue, close your eyes, and then we'll ask the patient, does he acknowledge that he has any mental illness? Then appreciation of risk. Then we'll ask ask the patient if he agrees to receive the treatment suggested by the treating team. If he can say, he can say yes, no, or you cannot assess. You have to write the explanation. Why did he say yes? Why did he say no? What explanation he did for saying yes? What explanation he did for saying no? If the patient says yes, then we have to ask him to explain why he or she agreed to the treatment. If he says no, then we have to ask why or she does not agree to receive the treatment. Last is communication. Is the individual able to communicate his or her decisions by means of any speech, writing, expression, gesture, or any other means? Finally, the decision is taken based on the interview, relevant history, behavioral observation, clinical finding, and on the basis of MSc by the mental health professional. If the patient has the capacity for treatment decision, including admission, or if the patient needs high support for his or her from his or her nominated representative in making treatment decision, including admission. And this is the performer that is suggested. Finally, in the fifth point, we have to take the signatures of either the patient if he has the capacity, or of the nominated representative if do not have the capacity. This is the performer that we are using in our institute. Take-home message. The treatment of mental illness depend on consent, which further depend on the capacity to consent. Capacity to consent depend on the ability to understand the information, see consequences, and communicate the decision. The Mental Health Care Act Section 86 deal with voluntary inpatient admission. In case of minors and lack of capacity, Section 86 and Section 89 deals with it respectively. Capacity to consent and validity is assessed periodically. These are my references.
So if anybody has questions regarding presentation, if you have not understood anything or if you have तो प्रायशी आपने वो बताया ना लीज सेक्टर डिस्ट्रिक्ट होना चाहिए वो how is this capacity like having these restrictive environment or best interest of person with mental illness?
So if the patient if the patient is lacking his capacity, is not having capacity, the decisions will be taken by nominated representative. So it should be in the best interest, as in according to the past wishes of the patient or the history or what he wanted. It should the nominated representative should not take the decisions according to his will.
How is it relevant to the thought that you're giving? Just additional information should give you why you want to tell us this. In my this information should have skipped it. But like that is another thing. Whether what we will do if the patient has a capacity or does not have. This term capacity. Have you referred textbooks or textbooks? Did you find this term anywhere? Yeah.
So in mental health care,
In mental health care, in other area, did you find that term?
it was there in Oxford.
So, this section.
The forensic psychiatry consent.
Forensic
Consent.
So it is basically part of what you say. Capacity assessment falls under forensic psychiatry, right? So when do you need to assess capacity? We need to assess capacity in populations. Every patient we need to assess capacity comes to
Every patient are above 18 years of age.
And
If he wants to get admitted, if there or further treatment is required.
So assessment is there for patients who you think will get admitted, or should capacity assessment be done for all the patients?
So admissions.
Admission purpose. So why are you not doing it in every patient? Only in patients who require admission. What is capacity? Capacity क्या होता है?
Capacity is the ability to take any decision, decide.
So capacity to decide, capacity to take a decision. First of all, you have to assess whether he is able to take a decision. So where you think the patient's decision may alter the treatment, or you think that the patient, like even if some involuntary patient is brought to you, and the caregiver themselves may not be ready for operation. Treatment. So wherever you think that this should be documented, where you think that the patient does not have the capacity to take the decision. Okay. तो हमको करना है यहाँ पे why we are talking about capacity is because now we have an act and we have voluntary admission and supported. So who takes this decision? The patient. Whether he wants to get admitted voluntary में कौन आएगा? Whether he wants to
Patient.
get admitted or not get admitted. Okay, what I can do? Take signature from any, take signature from impression of any catatonic patient also. Okay, ask the various patient to sign. Okay, psychotic patient to sign and say that he is voluntary. All right, so maybe to check that thing, it is required that you are certifying that the patient has the capacity to decide. Okay, it is not the capacity, as you yourself described, it is not like he has psychosis or he has substance abuse. Just because he has mental illness does not mean that he does not have the capacity. A psychotic patient, we know sometimes the psychotic patients, they are themselves voluntarily coming alone, asking for antipsychotic treatment, coming on follow-up. And even when we ask for hospitalization, we don't have to force all the patients. Many patients will be able to say, you'll get hospitalized. Say, yes. Okay. And some of them say no. That is his decision. Okay. This ability to take decision, yes or no, that is the capacity. Okay. A patient may, so if a patient has capacity, you say that he has capacity, and he says no to treatment, can you admit that patient in supportive care? Yes or no? Yes. Yes, sir, yes. Can you? The patient has capacity. You say that he has the capacity to take a decision. So after that, can you admit the patient in section 89? Okay. Admit the patient is supported patient. That is it. Whether a patient requires hospitalization or not, that is your decision. Clinically, he requires hospitalization or not, he is a danger to himself, or there is a clear indication for hospitalization. Okay, that is one. Suppose he has requirement of hospitalization, the patient has capacity, and he says no, then you can only admit under the other section of medicine. You can't admit him under voluntary. Okay. So if the patient does not have capacity, then he cannot be admitted under the voluntary section. That is the only thing. You can only admit patients who are voluntarily saying they have the capacity, they have the indication, and then you admit them under voluntary. They have the capacity, they have the indication, they are saying no. Then you can say against their wishes, you are admitting them. Okay, so just because they have the capacity does not mean that they are making the right decision. All right. So you don't have to say that the patient is having psychosis. He does not have a capacity. तो पहले ही बोलिए आपने psychosis का जरूरत नहीं कि उसको capacity होगी नहीं. That is where I think we need clarity.
Then there is also a term that is if the patient has capacity.
Yes.
And he requires admission and he is not willing for admission.
Yes.
Then there is a term wrong decision or
yes.
Then sir.
He has wrong decision is not a disqualification for capacity. Psychosis a patient to that does not mean that he does not have capacity. Or he is taking a wrong decision. Like he is hostile, he is paranoid, he is saying that I am God, I don't require explanation. So, but does he know what is the difference between getting admitted and not getting admitted? Does he know what is the difference between, you can say, taking treatment or not taking treatment? So, वो capacity अलग है और hospitalization के लिए वो हम लोग मतलब कैपेसिटी होने के बाद भी हम लोग उसको एडमिट कर सकते हैं दूसरे वो मना करे तब. So you should have clarity in that. There may be a permanent solution. Like you may have I don't know hospitalization, I do my work from home, I don't require any treatment, I don't have any investment. So that is inside. Very happy to do that. capacity is different from consent, and it is different from insight. These are different. Insight is a patient thinks that he has illness or not. Alright? Diabetic patient, medically, I don't want treatment for diabetes. I don't need medication. Chemotherapy के लिए इतना कर सकता है, मैं इतनी ठीक हूँ. वहाँ पे तो जबरदस्ती नहीं करते हैं. मैं उसको पकड़ के उसको फुल स्लीप करो, उसको इंसुलिन देना ही देना. फिर भी respect the patient's wishes. So similarly in psychiatric patient also, just because the patient has psychosis, for example, if somebody has like you think that otherwise the patient is not in danger, okay, you can't just hospitalize him because he is not agreeing with you to take treatment. Right? In most of the cases, I think in 95% cases, it is like because you think that he will be either be a harm to himself or he will not be able to take care of himself. So there's no make a ground for, you can say, admitting under other sections. That is why this is specifically for mental health care patients, psychiatrists. Other doctors can't do it. कि जो है amputation चाहिए, नहीं तो gangrene हो जाएगा, अगर मैं तो नहीं कराऊंगा, तो आपने जोर से पकड़ के patient को ताकि section 89 and stamp plate कर, वो आप नहीं कर सकते, हम लोग कर सकते. That is why we have this power, but that is why you require checks on this. Okay, other you treat, you see psychiatry with the discipline. So we have a check and balance. Okay. We can treat the patient. Yes, but you have to take this. There are clear indications for that. Okay, say patient who is not a harm to himself, physically, he was suicide personality, may not be working. Can say staying alone, just because of the caregivers, you can say consistency, or you require a diagnostic evaluation, detailed evaluation. Many times you admit the patient. So in that case, you can't admit the patient if this is merely for a diagnostic evaluation, merely for say some, you can say other therapy. You can't admit the patient. You should have a clear-cut indication. So here, capacity is different thing, consent is different thing, and having insight or not insight is different thing. A patient may lack insight. Okay, imagine आपने कहा पर हम आपको कुछ इलाज करना चाहते हैं, कर लेंगे आप? हाँ, गलतियों में जाते हैं, हाँ चलो हो जाओ. उस पेशेंट को कहाँ पर रखोगे? वॉलंटरी में आएगा? आएगा? पेशेंट है टर्नाइड स्किज़ोफ्रेनिया विदाउट इनसाइट, ओके, कह रहा है मेरे घर वाले मेरे खिलाफ मुझे मारना है, खाना खिलाना है, तो आप हॉस्पिटल में हो जाओगे. हमको लगता है आपको बीमारी, हमको इलाज करना चाहते हैं, कुछ टेस्ट करना चाहते हैं, क्या आप हॉस्पिटल में एंट्री अगर हाँ रक्षा हो जाएगा, ठीक है, चलो खा लूंगा, तो वो कहाँ है? इसको आपको समझ में आया? उसको कैपेसिटी है ना, वो मना भी कर सकता था, वो रेडी है आपके साथ काम करने. इसको साइकोसिस है, तो इसीलिए जस्ट बिकॉज़ ये साइकोसिस, he does not have insight, does not mean that he does not understand what is hospitalization, getting hospitalized, getting, वो है ना क्लियर कट तो पता है आपके टीम. Does he, can he understand comprehension of yourself? Can he say appreciate what you are doing? You are giving treatment. क्या schizophrenia की treatment पेशेंट को नहीं पता होता कि दवाई खाना ना खाना क्या है, एडमिशन होना ना होना क्या है, and he can communicate. एक ऐसा नहीं कि वो कोमाटोज है. ये तीन चीजें हैं तो उसमें कैपेसिटी है. Okay, not necessary that he has insightful insight. Okay, so that is why competence is different. If that patient is he competent to take a decision regarding his property, he is not competent to take any decision regarding his financial. You can say no, वो तो अपने घर वालों को बेदखल कर देगा. Okay. So capacity is the basic ability to take a decision. It will be right, it will be wrong. That should be there. Right? If the patient says no, even then you can hospitalize him, even if there is psychotic illness present. And that is why it is like you have to evaluate, repeat it. You have the patient is ready for hospitalization. I'm ready for hospitalization. You know, things fluctuate. 5 days, 6 days down the line, says no, I'm not ready. I want to go and deal with my family members. They are holding my. I want to go back and take some. Okay, discharge. You should continue. He has the capacity, but now he does not give you consent. Capacity is still there. So now you will hold it in the okay, capacity पहले भी थी, अब भी है, पहले वो अग्री कर रहा था, क्यों नहीं कर रहा? तो वो इसीलिए आपको ऐसा नहीं कि वॉलंटरी आ गया एक बार तो वॉलंटरी रहेगा. Today is ready, he is willing for hospitalization, willing for treatment. So you have to assess. क्या frequency उसमें assess करेंगे?
If the patient is admitted, sir, under section 89, once for 15 days.
86 में तो करना पड़ता है उसको देखने के लिए कि any time if the patient voluntary treatment का मतलब ये कि he can get discharge also later.
So ये भी fine.
Yeah. Okay. So उसका ये भी है कि वॉलंटरी आपने एडमिशन किया तो वो जब चाहे जा भी सकता है. अब अगर वो जाना चाहता है आपको नहीं करना तो आपको दूसरे सेक्शन में करना पड़ेगा. वो आप कर सकते हो. We think that he still requires तो शुरू से ही उसको 89 में करने की जरूरत नहीं है. ओके, कैपेसिटी अलग है. वो ये सब नो करता है, वॉलंटरी होता है नहीं होता है. वॉलंटरी मतलब नहीं. That is how you have like these are questions that are raised like intricate questions that how are patients with psychosis schizophrenia. You're taking consent for them for drug trials. How does that? Like schizophrenia basically is mania. How can you consent for drug trial? Basic thing is that you understand what is a drug trial. You understand what is a placebo. He is willing to take it or not. That is a difference. Okay. He agrees to that. So he should have the ability to comprehend, appreciate, and then communicate. If this is there, then he has the capacity to give consent. Okay. Then it is taken for वो हाँ बोल सकता है ना, उसमें आपको force नहीं करना. Just because schizophrenia है तो उसको वो कह रहे कि नहीं मैं participate नहीं करूँगा तो उसके केवल से आपने वो करना. The capacity is different, consent is different. Competence is different, insight is different. Insight, the patient may agree or not agree. What we assess basically at the time of admission for the voluntary, involuntary, वो तो हाँ ना बोलेगा, पर उससे पहले कैपेसिटी, इसकी कैपेसिटी ही नहीं है, तो वो ये डिसीजन नहीं ले सकता. डिसीजन ले सकता है वो हाँ कहेगा ना कहेगा, उसके बाद वो डिसाइड हाँ होगा तो वॉलंटरी है, ना होगा फिर भी रिक्वायर्ड है तो फिर वो 89 हो जाएगा. Any confusion? Yeah.
This is something that can be understood if you do it repeatedly.
Yes.
Just reading तो फिर confusion आता है क्योंकि हमें पहले जो MSc आने के पहले से हमें ये second equation देते हैं इसको समझ में नहीं आता. When we have that thing, second equation is tend to confuse insight capacity. So this is something that is new. MSc is compared to this is something that we have to do repeatedly. I think we should make it a habit of writing with a case paper. क्या section है कौन सा है क्योंकि जब वो सर आए थे inspection के लिए उनको भी यही सवाल था ना कि आपने कौन सा section में कौन से patient को किया. So I think this is a good habit to form it. So psychotic patients were willing for admission and many substance disorder patients were not willing for admission. यहाँ पे ट्रेंड तो ऐसा ही है तो क्या करेंगे?
इसीलिए and you see the person who can take capacity, access capacity. Nurse also. Nurse को सिर्फ ये देखना है कि उसको समझ में आ रहा है कि नहीं आ रहा है. वो समझ में आ रहा है comprehension. वो समझ सकता है benefit and harm. वो communicate कर सकता है. Psychiatric social worker, psychiatric nurse. Okay, they can also assess capacity. Insight is different. Insight के लिए कोई जो है, you require specialist. diagnosis is different. Right. Capacity is like you see that the patient is in plain terms कि उसको समझ में आ रहा है कि क्या नहीं वो समझता है कि hospitalization क्या है. The patient, those psychotic patients who refuse admission, you think that they don't know what is hospitalization? They very well know. That is why they are refusing. I am not telling. They very well know what is treatment. They are refusing. They have the capacity. They are taking a wrong decision. Their judgment is incorrect. I do not treat that capacity. Capacity is like delirious patient. He does not have capacity. He is not understanding. Children, comatose patient, catatonia. For example, the people. Those patients can't be when they don't have capacity to talk. हमारा जो टूल है वो दिखाओ वो एक बार हम भी यहाँ पे यूज करते हैं. ये तुम लोग भर रहे हो ये भर्ती हो एडमिशन के टाइम पे ये कर रहे हो. ओपीडी से नहीं करते सारे पेशेंट्स से नहीं कर रहे सिर्फ इमरजेंसी से कर रहे हैं. कैपेसिटी तो सब में करना है. सबसे जरूरी वॉलंटरी है सब में करना. सबसे सबसे वॉलंटरी है तो कैपेसिटी तो करना ही है. तभी हम उनको शो कर पाएंगे कि हाँ भैया इंटर वॉलंटरी सबसे सबसे I'm not. In that case, even if the patient is willing, that's capacity we can't take it because of the age that they may not have the understanding of actually hospitalization treatment, what are the cost implications, okay, what are the future implications, a number of things that are child will not be aware. Because of that, you can write that they are willing or not willing, but the thing that you have to that is also supported you. Capacity, so most of the patients who are conscious or oriented toward good comprehension will have a capacity. Some will say no. As psychotic people, most will say no to treatment. They will come and write. Some, a minority of cases, who have capacity, have psychotic, will still come under. It is not a clear like question. Schizophrenia का patient हमने volunteer करके कैसे कर सकते हो? There is if capacity, if it consumes, then you can do it. Still do. But if he, that is a reversible process. Capacity is not reversible. Capacity as well. Consent is reversible. Consent to treatment. We can withdraw consent anytime. Okay. बेस्ट यही है उसमें फॉर्मेलिटीज पूरी ऐसे जो सपोर्टेड में होता है वो भी लेके करें केयर गिवर कंसेंट भी लेने करें ताकि जस्ट इन केस अगर हमको शिफ्ट करना पड़े तो उसमें वो ज्यादा होना है कि पेशेंट इज नॉट रिवीलिंग एनएबीएच का रिक्वायरमेंट है. एनएबीएच कहता है कि यू हैव टू फॉलो ऑल द laws and guidelines of the state and the PMDT में वो सब कर. लेकिन पर्टिकुलरली पर आपको जो भी है अभी हमारे यहाँ पे नहीं तो हम लोगों को उस हिसाब से आएगा तो करना ही पड़ेगा. आज की डेट में हम करें ना करें तो ऐसे स्टेट पर एनएबीएच में ये है कि जो भी लॉज है आपको फॉलो करना. कंसेंट तो सबसे मेन आरटीएम से लेकर के जो प्रोसीजर किसी के लिए हर सेक्शन कंसेंट भी मुश्किल लेनी है. कहते हैं रेस्ट्रिक्शन के लिए मुश्किल तो है. मुश्किल है कि whenever you restrain a patient you take consent. So that is not only for psychiatry or even in medicine or ICU you have to restrain your patients. comments?
Presentation is open up to slides, but more than theory, you have to use it practically. And then
Good presentation. So yeah, you yourself have to be like, it is a little, you can say, conceptual. Capacity assessment per se is not that difficult, but how it is different from other things that you can't use capacity for instead of concept. You can't use capacity for competence. Okay. So that is a difference. किसी में कैपेसिटी होगी नहीं तो उससे तो कॉम्पिटेंस होगी तो बेसिक चीज है डिसीजन मेकिंग स्किल है ना पहले जब हम जब भी कंसेप्ट लेते हैं कोई मतलब जो है इसीलिए जैसे वहाँ पे देखते हैं पेशेंट कॉन्शियसली ओरिएंटेड नहीं है तो अगर मान लो कि एडमिशन करना है या उसको ऑपरेट करना है देन यू टेक कंसेंट Okay. Yes.
Within that, there is a lot of trains also in India, like
Yes.
Lego pillars, like Lego pillars. They need for big rates. Yeah. So according to that, and some crane investigations are policies.
That is also not like if somebody has psychosis, that does not become an automatic defense. Right? You have to prove that he did not have the capacity to understand his acts. He can be punished for their acts also. Look.
बंद कर दीजिए recording.